Good afternoon. My name is Melissa, and I'm a registered nurse currently working as a senior nurse manager of a medical surgical unit at a large academic medical center. As a nurse leader, I am highly invested in working for and promoting policy changes that will benefit my profession, my organization, and my patients by improving quality and reducing costs. A hot topic in healthcare is observation or OB status. Patient being placed in observation status versus being admitted as an inpatient is placing financial burden on hospitals and our patients. Medicare defined short stays for a set of services as observation in an effort to save costs, and many private payers have followed suit. However, a 2013 study by Sheehy et al. Found that for about 4,600 observation stays in one academic hospital, there were over 1,000 diagnosis codes, and in certain populations, over a quarter had stays that were greater than 48 hours. That's not a short stay. The study also found that the cost for caring for these patients was less than reimbursement, creating a financial loss for the hospital. Observation status pits the hospital against their patients. Under Medicare and other providers, observation status is not covered as an inpatient stay. This results in higher patient fiscal responsibility. Proposed legislation to ensure patients are informed of their OB status puts a patient in a position of choosing to forego their tests and treatments or attempting to persuade the physician to admit them as an inpatient. However, choosing the wrong patient status can be costly and results in fines and millions in recouped payments for a hospital. Often OBS patients need rehab or skilled nursing placement, yet stays in OBS status don't count toward the 3-night stay needed for this coverage under Medicare. Patients either pay out of pocket or they need to forego this treatment. There is current legislation attempting to fix this requirement also. Other costs aren't as obvious. My organization, an enormous amount of time and resources are spent managing OBS status patients. We just hired a physician leader that's solely dedicated to managing patients in this status. Often, OBS patients' tests are prioritized over inpatients in an effort to get them discharged, thus increasing stays and delaying care for our inpatients. Not to mention that unsatisfied patients cost organizations money. Some have found success with building dedicated observation units to focus care, but this is less than a third and is an expensive solution in itself. Finding a solution to this problem will decrease uncompensated care. I also believe that it will result in improved patient outcomes as care is prioritized based on need, and resources can be diverted from managing a status to actually caring for patients. Patients will also be more satisfied with their care. I propose legislation to completely eliminate observation status. Rather than spending money to fix a broken system, the system should simply change. All patients should be admitted as inpatients for their care under a tiered diagnosis-related reimbursement. This will improve the delivery of care for both providers and for patients. Thank you.